I think for me, bringing the reality of what happens in government to our consciousness so that we can see on the ground what we're doing every day, how policy impacts us, and thinking of ways that we can bring the knowledge from our experiences to the legislators, to the representatives, so they understand the impact of the decisions that they make. For us on the ground, being frustrated without having a voice is very disempowering. By coming here and seeing that you can actually have a direct communication with somebody where you can actually make a difference is very empowering, and I'm hoping to make a difference by at least having some conversations, learning the process, and bringing that information back to my group so we can start to have a voice as a hospitalist group.
I think it's important for us all to be here because I don't think physicians advocate enough for the things that are important for us. When our senators and our representatives see us and see that we actually live in their district and we care about these things, they will hopefully pay more attention to some of the things that are important to us, like the Medicare observation status and the 3-day rule, which is so important for all of our patients because we find that we can't appropriately put them in the right level of disposition because of an arbitrary rule that was put into place 20 years ago.
Well, I think it's important for the congressmen to put a face actually with their constituents, and since we're all from our specific states representing the people of the specific state, in my case Florida, I think it's important to actually put a face with that, and that our views and our things that we're representing for SHM are brought to the forefront so it can actually become an issue that they're aware of. All the Medicare reform, Obamacare, I think there's a lot of positives, and I think we need to stress that, as well as giving our input to help them tweak different issues that are going to become to the forefront in the next couple of years.
I came here today to find out how does the Congress affect the patients in my little small town. And they do. And so I'm here to talk with my representative, Congressman McIntyre, about H.R. Bill 1179, and also with my Senator Burr on Senate Bill 546 in regards to the care of my patients.
I think it's important for physicians to speak with our elected representatives, to educate them about issues that are important, especially for patients and for the future of healthcare. They get a lot of information from a lot of different groups, and sometimes it's very confusing. But to get it from physicians who are actually right there in the trenches and able to give them the nitty-gritty as far as how things operate, what patients go through, is very important for them and to help our industry as well.